Most of the time what we notice, like patient have a question, or what I notice, like my juniors, my colleagues, even my seniors also, they are also getting the same kind of question with their patients, like how osteopathy really works, means what is the basic fundamental thing, how it's healed and how
Okay.
it works.
Well, the question you're asking me is, what do you say to the patient? Is that the
Yeah.
question?
Yeah.
Okay. So what I would say to you, a colleague, versus what I'd say to a patient is quite different.
Okay, tell us both the answers.
No, the answer is coming right now. Because I don't want to spend my time explaining things to the patient that are just going to get more questions and more explanations, and it's still not going to be clear. The patient has whatever knowledge they come to the table with, whether it's medical knowledge, knowledge from Google or search engines, and I respect all these concerns they have. I've always told patients, if the doctor doesn't want to answer your questions about your health, find another doctor. But I'm going to answer the question succinctly and then move on. As the therapist, I understand that the patients, all of this knowledge that I'm going to try and tell them is not going to help them to get well. Let me do my treatment. So I want to answer the questions quickly to your satisfaction so that I can then work. Not for you to understand osteopathy, because as a colleague, you can understand osteopathy. As a patient, I need something simple for you. How is osteopathy going to help and then start naming the condition? Okay, one, I don't ever promise results to people because we're working in medicine. I'm going to work to the best of my ability, which is what Dr. Sutherland said, the father of what is misnomered as craniosacral therapy. It's a misnomer. He called it osteopathy in the cranial field. He said, results not guaranteed. Only guarantee we're going to work to the best of our ability. I tell patients that. Second, how is osteopathy going to help me? What does osteopathy do? What I do is I grab my shirt and I twist my shirt, and we can all see where the lines in my shirt are going. And I say, I'm going to look through your whole body and see where things feel restricted to me. That may not be where you're complaining. Where you're complaining, yes, I'm going to find local restrictions, and I'm going to use various techniques to reduce the tension in that area so that blood flow will be better, lymphatic flow, fluid flow, muscle tension. I'm hoping to reduce all these things. It's a very old classical idea to look for a key lesion, okay? And that's the twist in my shirt. Maybe you don't have any pain at the twist, but I feel that tension. So I'm looking locally and regionally for where tension is, and I'm looking for things that feel much more important to me as far as tension. I'm going to use various modalities to try and reduce that tension, and we'll do a couple of treatments, and then we'll go back to your set of complaints. Have I addressed the reason why you came to me in the first place? Going deeper into that explanation, they're not likely to understand. You're likely to get more questions, and it doesn't make the process any simpler. And as a matter of fact, the more technical you get, the more frightened a patient might be.
Yeah, sometimes also we feel the same kind of difficulties, like the palpatory skills osteopath has. It takes years to build those kind of palpatory skills, but when we have to explain those things to the patient, it's very difficult to explain those things.
Well, I'm going to tell you a story which may or may not work for you.
Okay.
Vladimir Horowitz was a famous, not Vladimir Horowitz, Rachmaninoff was a very famous pianist, classical pianist. And he said about his own skills, he said, if I don't practice every day, I notice the difference. If I don't practice every other day, my trainer knows the difference. If I don't practice for 3 days, the whole world knows the difference. Okay, so he was a pianist at a very high level. We're saying osteopathic palpation, which has many different kinds of palpation within osteopathy. There's many different theories and different types of palpations. Okay, some people are skilled in A, not in B. Maybe C is difficult. There's many different flavors in osteopathy. So some of these skills are easier for particular individuals, some have to be worked at. But it's not something the common person is going to be associated with. So to explain how it is you can feel this subtle feeling, it's very analogous to the cardiologist listening to your heart and being able to make a lot of determinations by what they hear listening to your heart. And if I put the stethoscope on a patient and say, do you hear that? They hear boom, 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 because they haven't been trained to listen and spend that amount of time. So again, explaining things to patients, expecting them to Expecting them to understand to the level is not going to happen. It's not likely to happen. So I keep my explanations simple.
Okay.
Because at the end of the day, if I'm able to help them with their problems, well, Dr. Sandin, he's wonderful. And if I don't help them with their problems, he's an idiot. Why did I waste my time going there? So the explanations, I find, it's not productive